Out today and participating in the press conference regarding the dengue outbreak. As most of you are aware, since notification on November 4th, the county and the state have been working very closely together on the response to the outbreak. And we're very fortunate that during the process, a request was made for the assistance of the Centers for Disease Control, and Dr. Peterson has been on island here since yesterday morning and has been out in the field as well as in here participating in our daily operations brief with the stakeholders across the state, and has at this point probably gotten somewhat of a perspective on what's going on. And the whole basis for that request for assistance from CDC was to give us somewhat of a third-party assessment of the outbreak as well as an assessment of our current response and operations. So without further ado, I'd like to turn it over to Dr. Peterson to give you his perspective currently, as well as some of what activities he's going to be involved with going forward.
Yeah, good morning. My name is Dr. Lyle Peterson. I'm the director of CDC's Division of Vector-Borne Diseases. This is the division that's responsible for diseases that are spread by mosquitoes. I would like to brief you this morning on CDC's activities with respect to the ongoing dengue outbreak on the island of Hawaii, my initial assessment of the ongoing response effort, and my thoughts on the future outlook for this outbreak. However, before we get started, I would like to remind everybody of the importance of taking steps to protect yourself from dengue, especially if you're in an area where dengue transmission is ongoing. Fight the bite by wearing protective clothing and repellents, and take steps to protect yourself while health officials work to bring the outbreak under control. So during outbreaks such as this, CDC provides technical and laboratory support to state health departments who remain in charge of the outbreak response. We're not here to take over, we're here to assist. In this regard, CDC has worked hand in hand with the state and local health departments here on Hawaii from day one of the outbreak. Our initial activities with the Hawaii Department of Health included confirming the state laboratory results, testing patient samples for other exotic mosquito-borne diseases such as chikungunya virus and Zika virus, which are also mosquito-borne viruses circulating in the Pacific, and ruled those out. We've conducted advanced molecular test or genetic analysis of the dengue viruses circulating on the island right now, causing the outbreak. We've provided test kits and advice on laboratory testing to the state laboratory. We've provided new experimental mosquito surveillance traps, proven effective and easy to use in other settings, and have been discussing actively the epidemiological findings with the state health department. As of this week, we have 3 CDC personnel on the island. I am here on request of the state and county to assess all aspects of the ongoing dengue-related response efforts and to make any suggestions for improvement. The senior entomologist, Dr. Ryan Hemme, that's Hemme, and an entomology technician, Gilberto Felix, Felix, are also on site on request of the state health department. They will conduct an evaluation of the mosquitoes causing this outbreak, conduct training, and help assess control efforts. We anticipate that they will remain on site for approximately 2 weeks. Now I'd like to share some initial findings of my evaluation of the dengue response efforts by the state and county, which overall I have found to be timely, well considered, and appropriate. First, the surveillance system has effectively identified dengue cases and has been instrumental in guiding the response. For example, the initial data suggested a major initial focus of dengue activity and subsequent dengue spread from the Ho'okana Beach State Park in South Kona, which is a popular camping site for residents all over the island. Based on this finding, the county officials immediately closed the park, which undoubtedly prevented many further infections and spread of the virus around the island. Second, patient samples are being tested at the state laboratory using state-of-the-art methodologies, and test results are being returned to the requesting physicians extremely rapidly. This is an important part of any response to a dengue outbreak. Third, it is extremely important for persons who develop unexplained illness with fever to be evaluated for dengue. The Hawaii Department of Health, county officials, and many partner organizations have mobilized an extensive effort to get this message out to the diverse populations living on the island of Hawaii. Fourth, it is important that healthcare providers identify patients with suspect dengue and properly treat those with more severe disease. Efforts by the Department of Health, including sending out health alerts, will continue to help in this regard and should be continued. Fifth, I'm very impressed with the coordination between the state and county government, and this is among the best I've actually seen in many outbreak situations in many different settings. Unfortunately, dengue won't be the last mosquito-borne health threat to the state, and the relationships and expertise built now will be of considerable benefit for years to come. Finally, mosquito control efforts have to be mobilized quickly. Nevertheless, dengue outbreaks are extremely hard to control, and it is imperative that additional effort be put into evaluating the effectiveness of the current control measures. Our CDC team will be here to assist with this effort. This outbreak also highlights the need to maintain a robust entomological capacity in the state for the long run. Now I'd like to make some concluding remarks about this outbreak. First, I cannot predict how long the outbreak will last. However, the last major dengue outbreak in the state, which was on Maui in 2001, lasted approximately 10 months. Thus, we must be prepared for the long run. We're only a few months into this. It could stop next week, but based on previous experience, it could certainly go on for a number of months to come. I also cannot predict how many cases will eventually occur. During the Maui outbreak, cases trickled in at a slow rate throughout the outbreak without greatly accelerating into a major epidemic. The same trend now appears to be occurring on the island of Hawaii. One possible reason for this is that the mosquito species most responsible for both outbreaks, the one now and the one on Maui, appears to be a mosquito called Aedes albopictus, or the Asian tiger mosquito, which is present throughout the Hawaiian Islands. It does not spread dengue as readily as another mosquito called Aedes aegypti, which is only uncommonly found on parts of the Big Island, but not on the other islands as we know it. This Asian tiger mosquito, or Aedes albopictus, as well as the more efficient mosquito species that spreads dengue, Aedes aegypti, are extremely difficult to control. Thus, a realistic goal in terms of responding to the outbreak is to minimize the number of cases, knowing that it will be very difficult for any effort to eliminate the outbreak entirely quickly. Thus, if the outbreak continues for a number of months, it's not a failure of the response measures, it's just that we do not have the tools yet to eliminate dengue outbreaks instantly. But I would like to emphasize that the efforts to deal with the outbreak cannot be done by government alone and must be accomplished by everyone working together. The public can help by eliminating mosquito breeding sites on their properties, using mosquito repellent to protect themselves, and to seek medical care if they develop an unexplained illness with fever. So that will conclude my statement, and I can take any questions at this point.